Women, have you struggled with irregular or heavy periods, or maybe you're just struggling with acne or gaining weight? These are all signs of polycystic ovary syndrome. And this morning we are joined by Dr. Thais Aliabadi. She is joining us this morning as a practicing OBGYN and the founder of the website trimly.com. Of course, you've been on Dr. Phil, the doctors. You have a wide range of experience. So excited to pick your brain a little bit this morning.
Good morning. Thank you for having me.
Of course. So just first off, what is polycystic ovary syndrome?
So polycystic ovarian syndrome is a condition that affects 15% of women in the reproductive age. I call it the silent epidemic. These are patients with a group of symptoms, and unfortunately, they almost never get diagnosed in time. They can have irregular periods. They can have elevated testosterone symptoms like acne, hair loss, facial hair, body hair, weight gain, mood disorder, depression, anxiety. And it's the top cause of infertility on the planet. And yet these patients are not being diagnosed in time.
What are some of those underlying conditions that women should look out for?
So a majority of polycystic ovarian syndrome patients suffer from insulin resistance, which means their body cannot process the sugar they eat. Unlike other patients who eat sugar and their sugar turns into energy in the body, PCOS patients have insulin resistance, which when they eat carbohydrates and their bodies break it down to glucose, the glucose doesn't make it into the cell to turn into energy. It bounces in the blood and gets stored as fat. Because this blood sugar in the blood increases their insulin level, that high insulin has also a side effect of elevating their testosterone and causing, or androgens, and causing all these other symptoms that are associated with polycystic ovarian syndrome, which could be very difficult for them to manage. These are patients who go to the doctor with acne and they get acne medication, but it doesn't really work for them, or they keep gaining weight, or they have irregular periods, they have difficulty getting pregnant, they lose their hair. Usually, I walk down the street and I can pick out PCOS patients as I'm walking down the street. And I know that these patients are not getting diagnosed. And it has always been a passion of mine to bring awareness to this condition. And that's how I started my Trimly platform, just to bring some form of awareness to these patients and to explain to them that these symptoms are not individual symptoms. These symptoms are all part of one big disorder that needs to be addressed.
So you just mentioned your website, Trimly. Trimly is a coaching program for losing weight. So how can it help women with PCOS then?
I've tried for 20 some years to educate women on PCOS. And one thing I finally realized is that people come seek help for weight loss. And majority of those women have underlying conditions, especially PCOS. So I figured if I bring them into my platform for weight loss, then I can diagnose them with PCOS and explain it to them. So over the past few months that I've launched Trimly, we've been able to catch a lot of these patients. I talk to them about their infertility. We talk about egg freezing. We talk about weight loss. We talk about how to clear up their skin, how to make their periods regular. But one more thing that I wanted to talk about is a lot of these patients have underlying conditions. So because they have the depression and anxiety factor, that's part of this, the mood disorder is part of this condition, and they gain weight easily, a lot of them have a history of eating disorder. So, it's important to, especially for teenagers, when you have a young adult who's overweight, who has acne, who has irregular periods, who has a mood disorder, you always want to be concerned about an eating disorder. Or if you have a patient with eating disorder, is to make sure you don't miss PCOS, because if you fix their hormones from inside, you can actually suppress their symptoms and they won't need to, stick their fingers in their throat to bring up the food they just ate. So a lot of that comes from that frustration of not being diagnosed and not knowing what's going on in their body, which is really sad.
It is very sad, and there's so much we could cover here, but of course we do have to let you go. Dr. Aliabadi, or excuse me, Taisi Aliabadi, your website, Trimly, of course, people can learn more information there.
Yes, absolutely. We're here to help.
Of course. Thank you for being here this morning. We do want